Welcome along the studios of the African Renaissance TV from wherever you are watching us. This is the call. We are here to bring you live coverages of the SereKunda Health Center, SereKunda Minor Health Center rather, their 2023 data and awards presentation. This is happening here live at the Ibunja Theatre in Kanifing, the Gambia. This is going to be an interesting activity and event that is going to be seen SereKunda Health Center celebrating and then taking us through the achievements and then the nitty-gritties of their operations for the year. With the theme Empowering Wellness Excellence, that is creating dedication and innovations in the healthcare service system that they are doing here in the heart of the Gambia. But to bring you into all the happenings here, will be here, the African Renaissance TV will be here to bring you live coverages and then interviews as well as presentations that are going to be taking place here. This is Mohammed Bibaji from the African Renaissance TV. Well, yes, so we formally begin the red carpet discussion here with an honorable person that is here. But before we can go in the further discussion, we'll just like you to take a quick introduction of who you are, and then we can kickstart it from there, please.
Thank you very much. My name is Musa Kamara, the Regional Director of Health Services for Western One Health Region in Kanifing.
Well, that is a huge region and a very important region as far as the healthcare services are concerned in this country. But what are your expectations of today's event?
My expectations are to see to it that our staff to take stock of what the work that they have done, quality health service delivery, because that is one of our vision to ensure that we deliver quality healthcare services to the general population of the Gambia. So my ambition is to see to it that those stock taking is done to ensure that staff who are deserving are given the awards as far as those service deliveries are concerned.
Well, when it comes to award ceremonies, like you said, it's important. The people deserving it, and then so services to be commended, and then those recommendations as well as our celebrations are important. But then, on a final note, what message would you have for everyone out there, especially those in the healthcare system?
Those in the healthcare system, what I will tell them is that the public they are out there to ensure that the public is served. So let's endeavor to make sure that we do our utmost, because if you look at your background and capacity of whatever category of healthcare delivery that you belong to, you will see to it that the Ministry of Higher Education, Research, Science and Technology, that's MOHAS, and the Ministry of Health, government of the Gambia have given the conducive environment and the necessary tools and resources to ensure that we reach the level where we are today. So therefore, it should be a matter of giving back or plowing back the knowledge and skills learned from those institutions of higher education to the general population with regards to the knowledge and skills learned from the health training institutions.
Well, yeah, things are getting interesting here before on the red carpet discussions here. As you can see, one of the most important, if not the most important guest is here. He is the chief guest of honor on today's occasions. And we want to hear her reactions as far as today's discussions are going to be concerned. Welcome, Doctor.
Yeah, thank you very much. Let me begin by appreciating the OIC of the SereKunda Minor Health Facility, and also by also appreciating the Minister of Health by extension. I think this particular event is very important and also timely. Looking at the team, they are not only celebrating success, but also showcasing the health-seeking behaviors of people that are utilizing this particular health facility. And thirdly, also, is very important in the sense that they are showing their activities, and then other health facilities can also emulate from this particular activity that the SereKunda Health Facility team is embarking on this particular evening. It's very timely.
Well,
I appreciate it.
that is quite important. Like you said, it's not just an award ceremony or where they recognize the efforts of people and institutions through the SereKunda Minor Health Center, but also, like you said, that data presentation will give us everyone like a blueprint sort of to say, okay, the public can have access to the data as well as other hospitals or health centers can also manipulate, count on as a blueprint, for instance. So that is quite important. But then on today's event, on your speech or on your presentation generally, what do you think will be the most important part of it?
Yeah, the most important part is the sharing of the data from the health facility. I do not know when actually they will start or which year they will start sharing the data. But it's also very important for people to understand, just as I said earlier, the health seeking behaviors and also what are the prevalent disease condition that this particular health facility is receiving from the public. I think it will help a lot.
Well,
Yeah.
this is expected to be an amazing evening, and then with persons or personnel like a doctor here, it is going to be an amazing. Without just not the food, and then that is also an important part, doctor. For people like me, that is important. But we are glad to have you here. And then if you have one final reaction, what advice would you have for other health centers going forward, even prior to the event proper?
Yes, I think it's also health facility to start sharing their data because it sells or it signals a very good, important message to the public. Not only the health seeking behavior, but what are the prevalent disease conditions that people are also coming in to seek for. Because most of the time, when you now look at our health facilities, people only come to the health facility when they are sick. Also, looking at the team is promoting or empowering wellness excellence is also very important. That we are not only there to give curative care, but also the preventive part is also there. I think it's also very important,
Well,
and I appreciate that. Yeah.
that is our chief guest of honor, which is an important part. So you take it from her. We will bring you all the reactions and happenings from the program here this evening from the African Renaissance TV. We'll keep in touch as we bring in more people on the red carpet here. Well, yeah, so we have another very important representation here from the Edward Francis Small Teaching Hospital, and then she would give us a rundown of who she is first, and then we ask a single question for the interest of time.
Good evening, viewers. I'm Jennifer Umukoro, representing Edward Francis Small Teaching Hospital O&G Department, sent here by the matron of O&G, Ramatulai.
Okay, that is a good one. She is indeed an important personnel here today, and then we are glad to have her here. But on the final one question, how important do you think this activity is for the SereKunda Minor Health Center?
Well, I believe SereKunda Hospital has been of so much, will I say, benefits to the Gambia at large in improving the health and wellness, well-being. It has contributed in preventing illnesses a lot of illnesses within the environment of SereKunda and the Gambia as a whole. And I believe they have achieved so much in doing this because right now I think we have a reduced death toll. People are beginning to be more aware of their health and responding to it in time instead of waiting till it gets worse and then they die off when, so easily.
Well, those were good remarks, and so we wouldn't want to keep you long here, but we are really honored to have here on the platform. Well, before we can end this, before things can get interesting, in fact, we have the brainchild behind the organization of this, and whatever good you see around here, if it is going to be attributed to one person, it is going to be see, is it we call it the officer in charge? Well, I like the name, in fact, the officer in charge. What does it mean, being the officer in charge first?
It's not an easy task, and it's just an honor given to you because actually bulk of the work fall on you. Because if there is any failure, you are going to take the sole responsibility of it. If there is any success, you are going to take the glory. So it's 50-50. So it's just an honor given to a special person in the facility to be able to lead because everybody cannot be responsible if something happens.
Well, most definitely. And today, like you said, we are here to celebrate the successes, the good things that have been happening at that health center, at the SereKunda Minor Health Center. That is quite important. But on today's event, on today's happenings here, what are your expectations?
How my expectation is that today is a very special day. It's a history-making day for the staff of SereKunda Minor Health Center because after a tedious 1 year of work, we will be honoring some of the extraordinary hardworking staff. Actually, all my staff throughout the year they have been very hardworking, but some have gone the extra mile. So we need to recognize their hard work and their dedication and commitment to the service delivered during the year 2022-2023. So we will just be giving some award to them just to tell them thank you. But those who was not awarded, it's just an opportunity for them to take it positively to be able to work harder for next year.
Well, they will work harder. Even though I want to point this out, you are the officer in charge, but then I am the one in charge of this mic,
No
so
problem.
I will tend to hold on to my mic. But that is quite important. I mean, the other aspect of this is not just about the awards presentation. The data aspect of it is a fascinating one for me. How interesting should that be?
Yes. It's going to be very interesting because people just hear about SereKunda Minor Health Center. They don't know exactly what we are doing. So today the data is going to speak for us throughout the year what exactly we have been doing, the hard work we have been putting into. Is going to be very interesting because you will be seeing some figures, you will be seeing some work that have been done throughout the year. Even myself, when it was presented to the SMT, I was shocked that we were able to achieve such a great deed throughout the year. So that's what we want to share with the public.
Well, that's already a big congratulations to everyone out there, from the first to the last person in that entity or in that health center has been doing wonders. And then this is something, it is time for the Gambia and everyone to celebrate you. But we don't want to keep you long here. You are a very busy man, especially on this today's evening. But we are going to cut it short there. But this interview is going to continue with you somehow, somewhere
problem. Anytime.
next
Thank you.
time. All right, thank you. Well, if not for today's evening, I would have said beauty is for the arts or the artistic world. But then I am surprised that this is not really true. For the fact that beauty has been today scientific. Beauty is science. Beauty is at the hospitals. Beauty is at every sector of our healthcare system. Well, we are glad to have you here, the CEO of Insist Global. What do you have to say on today's evening?
Hi, everyone. I'm excited to be here. I want to add that we are STEM advocates, but also art is part of it. So, STEAM. So, creativity is in the sciences, it's in engineering, it's in technology. So, I'm excited to be here today and to be invited as a special guest. I want to commend the executive and the management of the SereKunda Minor Health Center, and also to congratulate all the trainees who and all the awardees on this great milestone.
Well, that is quite important. Like you said, it is a day that we are there to smile. It's the day that we are there to celebrate people that have done justice, people that have done good impact as far as the lives of people are concerned through the healthcare system. But if you have to say something else apart from the award ceremony, that is a fascinating also art part of this. That is the data presentation, where we get to see and understand the numbers behind those celebrations. How important do you think this is?
I think this is really important. I am a data enthusiast. So today, as part of my presentation, I'll be also talking about data literacy. I think we're in a world where we're exposed to so much data and we have access to so much data. So as a people, as a community, we really need to be literate and understand data and question data that we see, but also use data to make decisions in our work as well. It's very
Well,
important.
that is quite important. I wouldn't want to keep her long here, but then whatever she's going to say from the inside, I'll be able to bring it to you from the outside or to the outside to see and then get to hold of that information. Like you said, it's very important, and we are honored to have you here on the platform. Thank you so much.
Thank you for having me.
Well, we are here again. I'm having reactions from another important personnel in today's gathering here. The board chair of the SereKunda, the managing committee of this at the SereKunda Minor Health Center. Is an important person, and then we are honored to have him here. We welcome, sir.
Thank you very much. My name is Bubakar Senghor. I'm the chairperson for the SereKunda Health Center, Minor Health Center Management Committee, which is actually in SereKunda. So I'm very pleased to be part of those people who are honoring this important day.
Well, it's that important. This is a very important day. But then to be on the event exactly, how important is it to celebrate people or things that have gone right for an institution so as important as the SereKunda Minor Health Center?
Yeah, SereKunda Minor Health Center is one of the most busiest catchment area because of its location. The fact that it's located in the heart of SereKunda at the most busiest place, that is the market area, where you have the population actively on work on 24 hours, and they need the service of the people in terms of health delivery.
Right, that is quite important. I mean, having you is an important part. Like you said, SereKunda Minor Health Center is one of the busiest. I mean, and given the fact that it is in the heart of SereKunda, and then that is quite important. But I want to understand this. As far as you are concerned, what is the most important or the proudest thing for you within the SereKunda catchment area in terms of the Minor Health Center?
Yeah, like I said, one, you cannot talk of health when you don't have a population. because the population of SereKunda is very big. It's not only people who are passing the night there, but people who are coming because of the market and the position of SereKunda. So, and they need this service that is health delivery. At the end of the day, we need to have, the facilities. That is to have a health center or health post or even a hospital. And I think the need was there, the demand was there. That was why, because of there was no space, then they located to Carnifin, which is called Carnifin General Hospital. But as far as the minor health center is concerned, I think it's serving the purpose. Because normally, when people need delivery, at the end of the day, that is where they move to. When there are accidents, that is where they move to. When there is any time that they are called during the night, that is where, because it's easy access, and I think, is a necessity.
Like you said, this is indeed a necessity, but we are going to cut it short from here because this discussion is just getting started, and then we are sure to bring you back on this platform to discuss more on today's happening. But for now, thank you so much, sir.
You're welcome. You're welcome. All right.
Well, yes. So here, if you want to get any information about malaria, one of the right persons or the brains behind everything that goes good about prevention and then control or provision of support in terms of malaria is someone that is right beside me here. Dr. You're welcome onto the show.
Thank you so much. Thank you so much.
Well, on today's evening, what are your expectations as far as the data and awards presentations for the SereKunda Minor Health Center are concerned?
I'm just saying that congratulations to them because this is the first time I'm seeing such things happening. They did a very good thing. And data, that's why we can go. Without data, you can't do anything. All the projects that is coming in the Gambia here, you have to put your data on so that they will hear. Otherwise, you will not have what you want. So SereKunda Health Center, I think they are doing very well. We will be happy to see what they have for us today. Yeah.
Well, like he said, everyone out there is in expectation or in the anticipation of what we have from the inside in terms of the data and then the awards that are going to be given here. But like you said, we don't want to keep you long here, and then we are really honored to have you here on the ceremony. Thank you.
Yeah, thank you so much.
Well, officially, you can disregard my name and call me a couple for now because I am standing here with two beautiful ladies, and these are very important personalities for today's event coming from the SereKunda Minor Health Facility or Health Center. I want to get your reactions. First, what are your names?
My name is Fatou Jaju. I'm a senior nursing officer.
Well, and you are?
I'm Bintake M. Suare. I'm a midwife at the labor ward.
Well, these the people why we are here. These are people that are responsible for the awards, and then the whatever data that is going to be presented here, they are one of the key people that have contributed to that. But I want to get your reactions to today's event. What are your expectations?
Thank you very much for that question. I'm very proud to be here today. This is my first presentation or award. I've never attended one before, and I'm saying that the expectation is very high because we're expecting a lot of delegations, and for the presentation, I'm going to present on behalf of the maternity unit, and I'll make sure that I do my best.
Well, we really get in the sense of that, and that presentation is something you should look out for. And I'll be bringing you every bit of that presentation. That is quite important. But let's say, what are your expectations now?
Like she said, our expectations are to bring out those datas because the datas will tell us the achievements we've been having since at the beginning of the year to almost the end of the year. Yeah.
Well, that is important. So aside the data, I want to go off the science for now a bit. You're looking beautiful. So in terms of the food, what are your expectations? That's the last
It's going
question.
to be just fantastic. The food are going to be delicious, and we expect to serve everybody. Everyone to eat to their content.
Those that are not here, I'm sorry for this, but then you're missing out on something huge in terms of the food. But thank you all, ladies, for having me here.
Thank you.
All right, thank you.
So, ladies and gentlemen, distinguished guests, healthcare champions, good evening and welcome to the prestigious awards and data presentation event for the SereKunda Minor Health Center. This evening, under the theme of Empowering Wellness Excellence, Celebrating Dedication and Innovation in Healthcare, we gather to recognize the outstanding achievements and unwavering commitment of healthcare professionals who have a significant impact on our community. This evening promises to be a celebration of excellence and a tribute to the tireless dedication and innovation that drives our healthcare. So let's embark on this journey together as we applaud the heroes of health and delve into this insightful data that shape our mission for a healthier SereKunda and Gambia at large. Together, we will acknowledge the dedication and innovation that have transformed SereKunda Health Center into a beacon of hope and healing for our communities. So without further ado, permit my co-host to take us through what this evening holds for us. The program guides. Yeah. Yeah.
So, good evening once again, ladies and gentlemen. From the program guide today, we will start as customary with prayers. Then, right after prayers, we will have an opening remark from Binta Suare. Ladies and gentlemen, right after the opening remarks from Binta Suare, we will have our opening remarks from the OIC of SereKunda Minor Health Center. Right after the opening remarks from the OIC, we will have the Regional Health Directorate give us a speech. Then right after the Regional Health Directorate, we will have the Director of Health Services, who we expect to join us later in the program. Right after that, we will have a live band to play for us because the day is not going to be a boring one. We will, again, as the team said, celebration. We will celebrate our hard work, but again, it has to go with entertainment. So we'll have a live band in between that to entertain us. So right after that, we will have a presentation, the data presentation part from the staff of SereKunda Minor Health Center. Right after that, we will have to unpack the theme for this year's celebration by the host. Right after that, we will have another entertainment by a guest who is in our midst, but it's going to be a surprise for the event. So we'll keep the identity for now. Right after that, we will have presentation 2 by our very own Umi Jawara, who is here to entertain us today. She is a colleague at work, but she is also talented in another aspect. So we will want to explore her talent today just to entertain us for the event. Right after that, we will have the presentation of the awards for the day. Finally, on the list, we will have a vote of thanks from Ms. Rohingyai. So, ladies and gentlemen, once again, we would like to welcome you all to this year's annual award and data presentation ceremony of SereKunda Minor Health Center. This is indeed a historic day for SereKunda Minor Health Center, and it is customary as we celebrate this day every year. The day is as important as one can say, because celebrating the giant healthcare professionals, those staff that will go to extra mile to make sure that services are not interrupted in the healthcare system. So this day is as important as we can go through tomorrow. So ladies and gentlemen, once again, I'll hand over the mic to my co-host.
Thank you so much, Ramatulai, for that brief rundown. And we want to sincerely apologize for the late start of the event due to reasons beyond our control. And at this point, we want to recognize our able OIC, who has done everything in his power to make sure this day is here. Ladies and gentlemen, please help me welcome David Day on stage. Also, before we go on to the prayers, we want to give a special recognition to all the media houses that are present here, especially African Renaissance TV, for the exclusive coverage of this event, right from the red carpet show down to the hall here. Thank you for your efforts, and we really recognize them. At this point, permit us to call on David to lead us in the Christian prayers, and then we will have our Muslim prayers lead after that. Awards. Therefore, we want to join SereKunda Health Center to pray for his soul to continue to rest in peace. So before we go ahead with the program, I want to quickly dismantle our seating arrangement. Can we occupy the front seats? Probably that will look nicer. Yeah, with your green and blue. And then it's not okay. We can also occupy this space because the media will be taking it. And if the empty seats are showing, that's not going to be nice. Right? Thank you. Yeah, we may also join Aminata and the team. Please. Yes. Thank you. To lead us in the Muslim prayer. If he's not, then we will call on Mohammed Sediba to lead us into the Muslim prayers. Please.
Let's pray. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين الله لا إله إلا هو الحي القيوم لا تأخذه سنة ولا نوم له ما في السماوات وما في الأرض من ذا الذي يشفع عنده إلا بإذنه يعلم ما بين أيديهم وما خلفهم ولا يحيطون بشيء من علمه إلا بما شاء وسع كرسيه السماوات والأرض ولا يعوده حفظهما وهو العلي العظيم ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب سبحان ربك رب العزة عما يصفون والسلام على المرسلين الحمد لله رب العالمين.
We acknowledge the presence of God the Almighty in our midst. It is important that we commit the beginning into His hands, and He will safely take us through. Let's be on our feet, please. Let's humbly be on our feet, please. We are about to celebrate the people in charge of health in our nation. And we know that God, the Almighty, is the master over health issues. And so we want to pray to commit this session into His hands. Our Lord and our God, we want to thank you, and we believe that your presence is here with us as we are about to celebrate the awardees. Father, we are committing the beginning of this program into your hands. We ask that your Spirit will lead us through and that our joy will be full. We commit our awardees into your hands, and we ask that this celebration will be a boost in their lives, that they will do better. We also pray committing our seniors into your hands. We commit the one in charge of the entire institution into your hands. We ask that you continue to grant them wisdom and you continue to grant them sound health. Everyone present here, Father, we ask that you bring them sound health as we celebrate together. We thank you in the name of our Lord Jesus Christ. Amen. God bless you. Let's be seated.
From our able officer in charge. So hopefully when this evening passes, you will sleep a lot, because David has spent his entire month preparing for this day, and I think we've seen his efforts already. We want to applaud David and his team for coming up with this very important event for all of us. David, congratulations so far, and thank you for having this event being successful. Can I have that paper? A pen?
Okay, it's okay.
Yeah, yeah.
Good evening, Chief Guest of Honor of the University of the Gambia, Nursing Department, Dr. Geneva C. Sao, our able Chairman of the Health Center Committee, Mr. Babu Kasengo, our Chief Guest of Honor, Jojo Dun Tambelu, Regional Director, Western One, Mr. Musta Cham, RPHNO, Antifatu, Sayan, CEO of Bundu Matana and Child Health, representative of various program units, security personnel present, media, former colleagues, I say good evening to you all. Ladies and gentlemen, it is a great honor I stand before you today as the head of this prestigious health facility with great pleasure and a great sense of pride. We gather here not only to celebrate the exemplify the remarkable achievement of our dedicated team, but also to review the valuable data that identify our commitment to providing exceptional healthcare service. This accolade is a testimony to every individual within the facility, unwavering dedication and tireless effort for excellence in quality healthcare delivery. First and foremost, I want to extend my heartfelt appreciation to my family, especially my lovely wife, who is always supporting me, trying to push me, even though sometimes if I think I cannot achieve something, she tells me I can do it. And to my lovely kids at home, who sacrifice day and night, not seeing me at home, but always looking at me and telling me, you are the best daddy in the world. I appreciate that a lot. My heartfelt gratitude goes to each member of the health facility team, from the nurses, the public health officers, the laboratory staff, the data entry clerk, the pharmacy staff, the specialist care, to the administrative staff, the support staff, and everyone working within SereKunda Minor Health Center. I say thank you. We have achieved this remarkable recognition through your skill, your compassion, and your unwavering commitment. Hard work and restless pursuit of excellence have made all the difference in transforming life and providing quality health care service. Today, as we reflect on the substantial data generated that underscore our achievement, we are reminded of the immense impact we have had on both individual and community neutralizing our service. Our collective efforts have resulted in improving patient outcome, increasing patient satisfaction, and also strengthening bond of trust with those we serve. The data speak volume about our commitment to evidence-based practice, continual improvement on patient-centered care. Throughout the year, we have tirelessly strived to implement cutting-edge technologies, fostering interdisciplinary collaboration, and investing in ongoing professional development. These investments have allowed us to remain at the forefront of medical advancement, ensuring that our patients receive the highest standard of care. As a result, our facility has become a beacon of hope for those seeking healthcare, comfort, and passion. However, as we bear in the glory of this award and the positive data associated with our health facility, I want to acknowledge that our journey is far from over. We must remain restless in our pursuit of excellence by continuously challenging ourselves to push to the boundary of what is possible and never settling for anything less than the best. Our success is only temporary if we do not seize this opportunity to reaffirm our commitment to providing uncompromised health care to all who walk through our doors. Equally, we wish to celebrate a few of our staff who were identified as the outstanding staff for the past year, giving them a certificate of appreciation for their outstanding service throughout the year. Let us remember, the selection is a hard one. We all have been hardworking staff throughout the facility, but nevertheless, few of them have gone the extra mile to ensure that quality health care are delivered, and we cannot go without celebrating them. Let us also reflect on the immense contribution of our foreign colleagues who are not here with us today to grace this occasion. We pray that God's mercy and blessing will usher them into his bosom. It is important to note that it is a continuing process, and every staff is having equal opportunity to be recognized and to aim for which is to motivate the staff and bring a better competitive mind among the staff. We will be awarding these people, and for those who are not lucky to be selected, can you see it positively and endeavor to be among those to be selected next year? In conclusion, I therefore stand before you today as a proud representative of this incredible facility and remarkable individual who have strived. We accept this award in gratitude, humility, and affirm to resolve to continue pushing the boundary of healthcare for excellence, our commitment to the patient and the community we serve. To remain steadfast, unhindered but unwavering dedication to stay beyond the service delivery performance curve, neutralizing the data, insight, and nurturing a culture of compassion care for our patients. Thank you for gracing the occasion with your presence, for your continued support, and for recognizing the remarkable achievement for SereKunda Minor Health Center. Together, let us inspire one another to achieve even greater heights in the pursuit for better health care for all. Thank you.
Thank you very much, Mr. David Day, the OIC of SereKunda Health Center. So we say, the common saying is small but pepper. They call us minor, but we still deliver to the level of those that they call the majors, right? So from the OIC, he said data is key. And I'm glad that his staff are hardworking and supportive of him to make sure that we realize that we put that into actualization. He also mentioned that we are all hardworking. So if we are not awarded today, that does not mean that you were not doing what you were supposed to do. So everyone cannot be a winner at the same time. So like he said, it's a continuous process. We should all keep doing what we do best. Everyone is a winner, but we still have to recognize those that went extra mile to make sure that services are not interrupted. So it's a continuous process. We should not feel bad if we are not awarded today. Every year, same thing is going to happen. So you will be recognized as services. So ladies and gentlemen, allow me to welcome on stage the director of Western One Health Region. But before the director comes on stage, I will as well notify the general public that he is newly joining us. So we want to congratulate him as the Regional Health Director of Western One Health Region. Thank you very much. Mr. Kamara, welcome.
You can keep that copy. Use this one. Hello. Hello. To the high table, the Regional Health Directorate, Western One, represented by the Principal Nursing Officer, Dr. Jeneba C. of the University of the Gambia, and the guest speaker, Dr. Jojo, and Dr. Cham, the CEO of Bundum Maternal and Child Hospital, the officer in charge and staff of SereKunda Health Center, Director of Public Health Services, Director of Nursing, RAG staff, other facility representatives from Western 1 and Western 2, the National Assembly members of the area, ward councillors, media representatives, all directors, and the line managers here present or represented, the Gambia Police Force representative, the Gambia Immigration Department representative, representatives of the communities served, market vendors, KMC representative, distinguished ladies, gentlemen, and all protocols duly observed. Good evening to you all. We are gathered here to grace facility data presentation and award ceremony as part of efforts to ensure effective health service delivery and sustainable retention of health staff in the health sector. SereKunda Health Center, or Minor Health Center, being established in the late 1970s, is a minor public health facility that provides healthcare services to a wider range of communities beyond its operational area, catchment area. It has a serving population of 127,690, with 10 nurse midwives conducting 250 to 265 deliveries per month on shift duties, and 3,000 to 3,180 deliveries per year. However, there are success stories or achievements that need recognition or attention of the majority. Construction of a waiting shed for reproductive, maternal, neonatal, child, and adolescent health services, that is RAMCA, and an outpatient department was initiated by the health facilities staff in collaboration with the Regional Health Directorate through support from resource-based financing, that's the RBF. National equipment and incinerators for clinical waste management has also been provided by the Ministry of Health through funding from World Bank. This will ensure that clinical waste is properly managed from the facilities, not only SereKunda, but all other facilities within the West Coast region. With the advent of the National Health Insurance Scheme, development initiatives of health facilities will also be sustainably managed. The Ministry of Health, in collaboration with stakeholders and support from government under the leadership of His Excellency President Adama Barrow, will continue to support effective and efficient health service delivery in order to attain the Sustainable Development Goals for health. As a region, we want to register our thanks and appreciation to UNFPA, World Bank, NAS, that is the National Aid Secretariat, philanthropists, individual philanthropists, Ministry of Health, and other stakeholders for contributing their quota to the structural transformation of SereKunda Minor Health Center, while counting on others to follow suit. The Ministry of Health has high expectations for all health professionals and recognizes their important role in the health service delivery. Before concluding, I want to share some goodwill messages with all of you. And then it may not be business as usual, and that being the fact, we want to implore on all of you, all healthcare providers or all health professionals, to ensure that they serve the population well with your knowledge and skills for excellence in attaining the Sustainable Development Goals for health. You would bear with me that all of us seated here, from the high table down to the lower table, we've all passed through the tertiary institutions. Yes or no? And these education that have been acquired, or certificates, knowledge and skills, is courtesy of the government of the Gambia through MOHAST, that is the Ministry of Higher Education, Research, Science and Technology, and the Ministry of Health by providing the conducive learning environment, and study leave is part of it, to ensure, to name a few, so that at the end of the day, when we are done with our, we acquire our prerequisite knowledge and skills, we need to deliver. And then that delivery, wherever you are posted in the country, the people need to be served. That's why we said, serve the people or the population well with the required knowledge and skills gained from the tertiary institutions and health training institutions. The categories are there: the RN school, the nurses, SEN, that is the enrolled nurses and midwives in Bansang, CHN school in Mansakonko, and the public health, School of Public Health in Brikama. Another goodwill message that we want to share with you is that always remember fulfilling your obligatory duties, because regulatory bodies will monitor your practice. You will bear with me that you have the various councils. You have the Nurses and Midwives Council, Medical and Dental Council, Pharmacy Council, and the newest Public and Environmental Health Council. So each individual or health practitioner may likely find yourself under these professional regulatory bodies. So therefore, these would serve as watchdogs for whatever we are doing as far as quality health service delivery is concerned. So we have to be cognizant of the fact that there are regulatory bodies, so let us do what is right at all times. We know, you will also agree with me, that in epidemiological terms, the treatment of the disease, any disease that have occurred, and then there is supposed to be treatment, the treatment outcomes are three. One is, and the service provider's intention is to ensure that number one is attained, and that is for the patient to get cured. The other outcome is paralysis or disability. The third one is death. And for healthcare providers or health professionals, especially clinicians, physicians, doctors, never want to lose their patients. So you always want the patient to recover. So let us do our utmost to ensure that we give relevant and quality health service to the patients at all times. We would also implore on you to monitor staff punctuality at work. This is very important. You have the OIC of the facility, you have the other units which are also headed by senior staff of the facility. So each of these units need to ensure that staff punctuality or staff reporting to work is monitored and regulated. Observe the communication protocols. This is also important, that you have your unit head or you have your OIC. You cannot just bypass those and then call straight at the Regional Health Directorate or to Banjul for certain issues that you can manage at your level. So we want to implore on you to bear in mind these important core values. Ensure timely reporting of facility data to the region. Today we are gathered here because of what? Data. The data we generate. Ensure regular briefing meetings and share your minutes with the region. Monitor and encourage proper record keeping and archiving. This is also important. If visitors or supervisors of various levels happen to visit your facility and ask you questions regarding what and what you have been doing for you to show evidence-based proofs or evidence-based materials to ensure that you have done the work. So that is very important, record keeping, because without the record, you will say, I have done this, but where is the proof of it? So that's why it is very important for us to ensure that those records are kept. And we also try to analyze our data as much as possible so that data speaks into graphs and bar charts with regards to deliveries, with regards to steel bars, with regards to other services that we offer or render to the general population. Without wasting much of your time, I thank you all for your kind attention. Thank you.
Thank you so much, Director, for those wise words. And we just want to pick a few points from your goodwill message, which has to do with our healthcare champions serving their population with their knowledge and skills. That way, we can attain excellence in the SDG and health for all. Also, he did mention that we should fulfill our obligatory duties, and also we should be able to monitor punctuality and regulations at all times at our facilities.